Okay, we are here again with Dr. Debo at Michigan Spine and Joint Center. Last time we discussed sciatica, and this time we're going to discuss sciatica in me, a patient. So I'm at home and I'm in a lot of pain. One thing that we know about sciatica is that it's often worse in the morning. And that's because Dr. Debo can explain this more fully, but the disc swells at night because it imbibes water. So it swells like a sponge. And with that, you get irritation in the surrounding structures and the nerves, and that causes a lot of pain in the morning. So, Dr. Debo,
Yes,
what
sir.
do I do in the morning when I'm in pain?
Yeah, absolutely. So with sciatica, we confirmed, based on what we discussed last week, that is an irritation of the sciatic nerve in your lower back, and oftentimes could send pain down into your lower extremities, which are your legs. So, like he said, it's very common to wake up in excruciating pain in the morning. So now the question is, how do we get out of bed in the morning when we are in excruciating pain? So what we're gonna do is we're gonna have you lay on your back. Awesome. All right. So you've got pain in your lower back,
I do.
and this pain is shooting down into your legs.
Correct.
Could you point to me the part of the legs that you're experiencing that
Coming
pain?
back into the calf and into the back of my thigh.
Absolutely. So pain is constant, it's consistent, is annoying, I believe, right?
Right.
So what we want to do, a couple of things we could do. First, you could do a mini stretch in bed. Me personally, I love patients to do their stretches on the floor because it's a hard surface. But if you have to get out of bed, you have to get out of bed. So what we want to do is, I'm gonna have you bring this leg up. All right. So remember we talked about sciatic nerve running through your buttock. Okay. And you probably have burning sensation in your buttock, right? So what we're gonna do is you're gonna bring this knee to your chest. Okay. And then you're gonna cross the leg, and then you want to stretch. So here is what I want y'all to look at. You want to make sure that you feel pulling sensation in your buttock. So what we're doing is we're stretching this musculature to take pressure off of the sciatic nerve. And oftentimes that will help with your flexibility. So what you're going to do is you're going to hold it, okay, for about 5-10 seconds. And right after that, you slowly bring it down. Good. Very important that we breathe every time we do stretches. All right. All right. So we're going to do that one more time. All right. We're going to pull to the other side. You want to breathe. All right. As long as you're feeling that pulling sensation in your buttock, you're doing a great job. You want to hold it for 5 to 10 seconds. And after that, you let go. So the other side doesn't get jealous. I tell patients to do it bilaterally, which means you gotta if you stretch one side, you gotta make sure you stretch the other side. All right. We don't have that much time to demonstrate that, but just so you know, every time you stretch one side of the leg, you gotta stretch the other side. Now that that is all done, okay. So the next step is, how do we get you off the bed? So what you wanna do is you're gonna slowly roll to your side. And this time, this is the best side. You're gonna roll onto the good side. Awesome. You're gonna slowly bring this leg down, and you wanna push yourself up with your upper body. Keep your lower back straight in the process. All right? So we don't want you kind of twisting or bending. Remember, the sciatic, the nerve is not happy right now. So if we keep twisting in the lower back, we're gonna keep having pressure on the nerve that is extremely upset. So we're gonna slowly
Kind of tuck my tummy in as I
tighten up your core muscles.
Yep.
Awesome.
Good.
Awesome. First step done. How you feeling?
Good. Stable.
All right. Now the second step. How do we get you off the bed? So what you want to do is you're gonna move closer to the edge. Remember, your lower back has got to be straight all the time. You can't arch. You cannot extend. It's got to be neutral. You got to tighten up your core muscles, which is your stomach muscles, all right? And you're going to slowly draw to the edge of the dip, and then you're going to slowly get up with your back straight, core muscles. Perfect.
Good.
All right?
And stay mobile then, right?
Yes, sir.
Good. Well, thank you. That's good for now. We'll continue on with some more in the next video.